It also plays a centralizing and coordinating role in the entire body by virtue of a vast neural network. Through the nerves, the brain receives sensory information perceived by the body and orders the necessary actions, mainly muscle contractions.
OCD, obstructive compulsive disorders and related problems are related by many factors. It is a combined mental syndromes of various mental emotions and mental behavior. Now this is the brain. You see here, brain have few parts, 5 parts. It have 1, 2, 3, 4, 5. It have 5 parts and is related with the whole of the spinal cord. Now you see, this is a spinal cord. It is related, and the brain function is, now you can see here how it is done by the brain and the spinal cord and the entire nerves. So these are the parasympathetic nerves and this is sympathetic nerves. Now you see here, and most of the nerves are passage in head side. Now you can see here, but overall in this model you see here better you can see that this is a problem of whole body, and particularly this is related with the brain. Now brain is here, and now brain is here, and it have in the cavity. This is the skull, and it's a cavity, and it is here. So now the head is here, and it is closed with the skull bone, but the entire effect that goes to the spinal system. The spine is the controlling one, and that's why the changes in pathology of systems and in coordination in between various systems causes the obstructive compulsive disorder. There is other reasons, and it is said that it is a combined mental syndromes of various mental emotions and mental behaviors and intellectual faculties, disturbances, expressions in patient. Various mental expressions are diffused by the patient in his/her daily attitudes. Sometimes the patient becomes calm and quiet and not aggressive in response, but sudden changes his/her attitudes in violent or aggressive behaviors. This is happened due to several reasons and cannot impose to one alone reasons. Living conditions, familial environment, working conditions and working environment, physical anomalies, organ or systems, pathophysiology and pathological anomalies, hard mental work, unusual and unsettled jobs or services or business, unsatisfied with sexual indulgence, unsatisfied with the life condition and unsettled lifestyle, and rest and irregular food habits. Use of narcotics and alcohol eats are the responsible causative factors of disease condition. This is a curable condition in view of Ayurveda and ayush treatment. By virtue of Ayurveda diagnosis system, ETG Ayurveda scan technology, it is now possible to find the genesis of any disease problem inside the body. The Ayurveda blood examination and Ayurveda urine examination provides opportunity to analyze and synthesize blood chemistry anomalies inside the body. Concluding the problem and diagnosis, appropriate Ayurveda and homeopathy and Unani remedies along with the suggestions of changing food habits and lifestyle to meet to cure the sick person's condition. In our outdoor hospital at Kanak Polytherapy Clinic and Research Center 67/70 Bhusa Toli Road, Bartan Bazar, Kanpur, UP, India, all kinds of diseases and physical and mental ailments and disorders are treated by Ayurveda latest invented technology, ETG Ayurveda scan. Our specialty is unique in this manner that we are treating those diseases and disease conditions which are declared by consultants, physicians that they have no treatment or there is no treatment of the condition. We treat the patient by Ayurveda and homeopathy and Unani remedies and suggesting to patient what to do and what to avoid and changes in lifestyle. Obstructive compulsive disorders, OCD, is not an incurable disease condition. The treatment is possible, and if your physician says that the disease condition have no treatment, please do not panic with the statement of your physician. You can come for treatment to our research center, but before coming here, please have a talk to Dr. A.B. Bajpai on mobile number 8604629190. You can contact at our research center personally visits. You can log on to our website ayurveda.com to get more information about our work. If your any relative or concern is suffering from those disorders which have been declared incurable disease condition, kindly tell them about our research center. Thanks for listening. Thanks.
Hello, I am speaking Dr. Deshbandhu Vajpai from Kanak Polytherapy Clinic and Research Center 67/70 Bhusa Toli Road, Bartan Bazar, Kanpur, Uttar Pradesh, India. Today, this is a special Sunday broadcast in English for global community to bring into knowledge and understanding about Ayurveda and homeopathy and Unani and yoga and nature pure systems, so that every person who are not well aware of these therapies, they should understand what is Ayurveda and what is homeopathy and what is Unani and what is I am talking to yoga and nature pure systems. So in this sense, the understanding should be necessary to know about the Ayurveda totally, because you say as a alternative medical system, or you can say as a complementary medical system, Ayurveda and homeopathy and ayush therapies treatment are now popularizing all over the world. So the necessity is here to understand what is Ayurveda and what is other ayush therapy system. So today the subject is to introduce Ayurveda, different angles and different views before you to understand the gross reality. So now I am starting that there should be no any exaggeration to say that of all nations of the earth, the Hindus first turned their attention to the study of decision and the means of its elevations. There is no any exaggeration to in this statement that the Hindus was the first one who detected the problem that in the illness condition what to do and what can be done and how to done and why to done. So they have formed the Vedas, and in the Vedas there is undoubtedly the most ancient of written records in the world. As everybody knows that Vedas are the oldest compilation of our understanding, and the written records in the world and is found here. So from Vedas, the Ayurveda comes out, and the Ayurveda are science of life. Now it is said that Ayurveda is a science of life and believed to have a part of Vedas. So this is correct, and those that go by the name of the Atharvans, some say that Atharva Ved, the oldest one Veda. So Ayurveda is now introduced in Atharva Veda, so it can be a part of Atharva Veda. Some say so. Regarding this, no complete text is obtainable of the Atharva Veda. So it is possible to ascertain the science of life, how it comes in existence. So the in appearance, it is seen that the first great professor of medicine, the first great professor of Indian medicine or Ayurvedic medicine, you can say, is coming from the Atharva Veda. So the compiler of the Atharva Veda known well that what is to be done in Ayurveda and what is should not be done, what are beneficial for the health condition and how to maintain it. So it is said that the knowledge from Atharva Veda have been gained by or acquainted by Punarvasu and Atri. So these are the two persons who got the knowledge of Ayurveda particularly, and they are Punarvasu and Atri. Atri is said that he was the son of Brahman, and he is regarded as one of the Sikhs through whom the Vedas were revealed. So Atri is considered in this way, and now the difficulty comes before the fixing of the date, how much the Vedas are old. So the difficulty comes before everyone, because at that time some say that it is 6,000 years old, some say that it is 5,000 years old, some say that it is 4,000 years age. So years old. So how much old? So nobody knows about this one, but we can guess it that Ayurveda could be. I say could be round about 5,000 years old medical system, because if we calculate our forefathers, so if now I am now in my uh, forefathers, so 5,000 years ago, if I say that the age condition should be 80 years of every generation, so 5,000 years my forefathers, I think that up to the 70 to 75 generations before they came in existence, my forefathers, they came in existence before 75 generation. So if we calculate it, then 5,000 years before that means the 75 generations have passed. So it can be said that it looks like that it looks like logical that 75 generations have passed, and at that time the Ayurveda was in existence. So this is a this looks like logical, and can be said that aggregate we can say that it is a 5,000 years old medical system. So uh, either it is very difficult to fix the age, and I have told you a roughly this is a roughly estimation, and people doubted that whether we are taking the name of certain people, so whether they are existed or not. So cannot say about that one, because nobody has seen and nobody have evidences against it. So we can only guess it. And anyhow, the science of life, which is said Ayurveda, is in existence, and have several disciplines uh, like the subsequent generation, and to follow the Ayurvedic practice. They are Agnivesh, Bhel, Jatukarna, Parashar, Harith, and Chakrapani. These peoples, which I have taken the name of the persons, they are the disciples of Maharshi Atri. So every one of them, all of them, have written and compiled a treatise on medicine, whatever they have experience about the Ayurveda and its treatment. They have written as separate books, and these books are now available. Some of them are available, and some of them are not. So it is said that the Agnivesh is generally allowed to have been superior in point of merit, because Agnivesh was the first one, and he is now superior. He is understood to be a superior one. So it is believed that Agnivesha's compilation gradually superseded the compilations of the others. So just I have taken the name of some persons. So the compilation, they have also written their books, and so compilations. So the lectures of Punarvasu were probably collected together by his disciples. So Punarvasu disciples was the, as I have taken the name of earlier one. So they are written in prose, like the style of that time in the olden period, and in Sanskrit language. So that was popular at that time. Sanskrit was popular, and that was the only language in which the compilation is done. So the Charak have now came in existence, and he particularly revised the all persons work. It is said, but it is not confirmed whether Charak have done or others have done. So now Charak is the prime one who professes to have only revised the earlier work, gives us a version which consists of both prose and verse, and that is known as the Charak Sangita. And it is said that the Agnivesh work was uh, done by Charak, compiled by Charak and edited by Charak, and he added some more formula and more information about the and experiences what he have gained. So he included in that book. So each lesson of chapter, if you go through the Charak Sangita, so you will find the each lesson of chapter ends with a colophon stating thus ends lesson. Here occurs the number named and occurs the name in the division called such and such of the treatise of Agnivesa as revised by Charak. So this thing is seen in Charak. The probable solution is that Punarvasu lecture were collected and arranged by Agnivesha, who accordingly came to be viewed as the author of the treatise, which Charak subsequently revised. Might possible, it could be possible. So whoever was the author or rather compiler, the treatise consists of questions put by Agnivesha and others, and the answers thereto of Punarvasu. So the style of the book is written in the question and answer. The questionnaire asks about a problem, and the expert responses and answer in the in his own way, and both have been collected in the similar style, in the question answer style. So this is the style of Punarvasu. So some other received, then the six disciples of Punarvasu are mentioned as taking part in the discussions. But Punarvasu's answers are always recorded as the final deliverances on the topics. So wherever verses are introduced, they are referred to by Charak as those of the original work. The passages in prose seem to be abridgments of the matter occurring in the earlier treatise. That treatise could not really be in the form of lectures. So it, this all is in the form of question and answer, and just like today we see the essays are written on the any one subject. So this was not the style at that time. It was, on the other hand, a systematic work composed, as most works of ancient India were, in the form of questions and answers. Right? That was the style of at that time. Almost all the answers are embodied in aphorisms that are often exceedingly terse. The truth is, these aphorisms constitute only heads of discourses. They are for the use of the preceptor in the lecture hall. The learning and experience of the preceptor enable him to dwell largely on them for assisting the comprehension of the pupils. So Agnivesa's work, as rather Charak works as it is known to us, though valued by Hindu physicians for its therapeutical portions is in reality a vast and valuable repertory on a variety of subjects of the utmost importance to mind. So if you go through the Charak work, you will find the uh, things in I- all the matter you will find in the verses and in the prose both. The significant use of Sanskrit language at that time it was very prevalent in use. So everybody was speaking in the same language in the olden time, and this was the only language which was written and composed by every writer who is uh, in concern with the Ayurvedic. So it is in reality a vast and valuable repertory, therapeutical portions, and is in reality a vast and valuable repertory on a variety of subjects of the utmost importance to man. As far as mind concerned, this thing is very uh, lucrative to understand the views of the Sikhs who have framed for particularly to persons, and predestinarianism and its bearing on disease and treatment, the nature of the soul, what is meant by its birth, rebirth, and emancipation, the means by which emancipation may be achieved, the 150 form of things of their respective classes, what acts a man should do and what acts he should avoid. So now you can understand the actions which are to be taken regarding the health condition, the different kinds of mind, the qualifications of a preceptor, those of a pupil, the characteristics of the treatise to be taken up for study, medical consultations, the outlines of logic or dialectics, the duties of preceptors, the duties of pupils, the requirements of the sick room, those of the lying in room, and those of successful treatment, the causes of the destruction of cities and populous areas, dreams that prognosticate death, indications of the near approach of death, etc., etc., are a few only of the topics treated of in the work that goes by Charak's name. The topics may not be closely connected with one another or even directly connected with medical science as it is now understood. But then it is the method of the research. So, with the convent, as far as writing discipline, it is up to the convenience of research, whatever they have thought on, they have written and kept it either in serial or in, in other way according to to facilitate them what they have done. So it could be possible. But then it is the method of the research. It can scarcely be justified upon any consideration as to the aphoristic way of their deliverances. Much may be said in its favor. The fact is, the research were opposed to system building before the collection of facts. They thought that the first step in building science consists in the collection of materials. They therefore set down their experiences of facts and the results of their reasoning without much attention to rigid principles of classification. Lord Bacon speaks of these efforts of the ancients in terms of praise Another error, says Bacon, is the over easy and peremptory reduction of knowledge into arts and methods, from which time commonly sciences receive small or no augmentations, but as young men, when they knight and shape perfectly, do seldom grow to a farther stature. So knowledge, while it is in aphorisms and observations, it is in growth. But when it once is comprehended in exact methods, it may perchance be further polished and illustrated and accommodated for use and practice, but it increases no more in bulk and substance. It looks, the Bacon comments is now looks very correct, and this even happened now today. If you collecting any data, the collection of data is in the same way as it was in the olden way. There is no change, but our knowledge of analysis is now much more better than before. So we, if we conclude anything, we think over every aspect of the subject matter, and then we conclude what is right and what is wrong. Now, in olden days, the facilities was very limited, and now today we have much more facilities and so many machines with us. So there is much more difference if you compare to the innovation and development of any medical system. So they have developed according to their own way. So Charak, now about the Charak. So again we come at the Charak Sangita. So Charak divided his work into 8 divisions. He written his book and compiled it. So in the book, he divided his work. Whatever he have thought, he have classified it and divided it into 8 parts, 8 divisions. So they are the first is the sutra or shloka. The second one is nidan. The third one is viman. The fourth one is sharir. The fifth one is indriya. The sixth one is chikitsa. The seventh one is kalpa. And the eighth one is siddhi. So these are the division of the Charak which he have done in his work. But the division of others are much more differ to each other and are not seen in the similar way. So Charak have 8 division and Susrut have also 8 division. So when we will discuss about Susrut, then we'll tell you what to do. So the first comprises, come to the Charak Sangita. The first comprises 30 lessons or chapters. The second, the third and the fourth each comprises 8 lessons. The fifth, 12 lessons. The sixth, 30 lessons. The seventh and the eighth each 12 lessons. Thus there are in all 120 lessons. Some idea may be formed of the value of the work from the details of the 30 lessons of the first division. The first 4 of these 30 lessons have drugs for their topic. The second 4 treat of the rules about the preservation of health. The third 4 deal with what should be done and what should be avoided or abstained from. The fourth 4 treat of the mode of administering remedial agents. The fifth 4 treat of diseases in special. The sixth 4 treat of the application of drugs to diseases. The seventh 4 deal with the ascertainment of food and drink. The 2 last treat of the life breaths and the ducts of the body as also of the accomplishment of physicians. So after Charak's compilation came another of great fame. It goes by the name of Sushrut. So we'll talk you on Sushrut on next Sunday. Now I think that you have got the primary idea of Ayurveda and its compiler. Those who have compiled the books Sushrut Sangita and other one. And in next Sunday I will tell you about much more about the Sushrut. So listen it. And one thing I would like to say that in our research center at Kanak Polytherapy Clinic and Research Center, Kanpur, Uttar Pradesh, India. My phone number is given here 86046299190. So we have got a 100% cure of the following disease conditions: the epilepsy, hysteria, leukoderma, psoriasis, avascular necrosis, chronic and acute pancreatitis, HIV, muscular atrophy, muscular dystrophy, fistula, chronic hemorrhoids, anorectal disorders, fatty liver, enlarged liver, ankylosing spondylitis, cervical and lumbar spondylitis, sinusitis and ENT problems, nephritis, kidney stones, diabetes, enlarged prostate, ascites, dropsy, colitis, uterine cyst, and uterus problems, and men's problem along with the other disease conditions. And we go through the examination, the newly invented technology, ETG Ayurveda scan, by which we managing and treating by testing the whole body, examining the whole body, Ayurveda diagnosis, high technology, electrophysiology, ETG Ayurveda scan, and latest invented and developed Ayurveda blood and Ayurveda urine examination with other possible tests to conclude the patient problem in total. We prescribe Ayurveda and homeopathy and Unani and other possible mode of management and diet and lifestyle suggestions and counseling them accordingly, which is essential part of treatment. If you or any relative or friend are in your touch or whom you know is suffering from any chronic disease and incurable disease condition and is feeling himself in trouble with the current treatment without any relief, kindly do tell them about our research center. I will like to request you for subscribe and share and like my channel. Tell about this channel to others, your friends and relatives, and especially to Ayurveda lovers and Ayurveda followers, Ayurveda students and Ayurveda therapy teachers and professors. The channel is dedicated to promotion and propagation for the development and raise consciousness and awareness among the global public about understandings of Ayurveda and homeopathy and Unani and yoga and nature cure systems for good health approach. Visit our website etgayurveda.com for more information and our activities. And visit our YouTube channel for updated video related to different aspects of Ayurveda and homeopathy and Unani and other system of treatment with updated information which are genuine and true and of practical usage in English and Hindi language. The contents are given in this video and telecast are only for the general information. It will be much better to follow the suggestions with the help of concerned medical systems, qualified practitioner or physician of Ayurveda or homeopathy or Unani and other therapies are concerned. Thank you for watching, and we'll see you next Sunday at the same time. Thank you. Thank you very much.
Speaking from Kanakwali Therapy Clinic and Research Center, Bhusatoli Road, Barsan Bazar, Kanpur, UP, India. Our center is equipped with the ETG Ayurveda scan and Ayurveda blood and Ayurveda urine examinations. 5 kinds of Ayurveda scan are developed which diagnose the every type of disease condition inside the body of patient with great care. Hello, I am speaking Dr. Deshbandhu Bajpai from Kanakpali Therapy Clinic and Research Center, 67/70 Bhusatoli Road, Bartan Bazar, Kanpur. My mobile number is 8604629190. Today in this video cast, I will tell you about the Ayurvedic remedy Sarp Gandha Ghanpati. I again repeat it, Sarp Gandha Ghanvati. The remedy is prepared by the herb Ralphia serpentina, which is a well-known remedy for ancient times. So, Sarpagandha Ghanpati is formulated by and combined by the other herbs to make it more beneficial. And this remedy is a very popular remedy for high blood pressure controlling. So after taking this medicine, the high blood pressure becomes normal, and with this, insomnia and sleeplessness and restless sleep. If anybody is suffering with these 3 problems, insomnia, sleeplessness and restless sleep, then this medicine is beneficial for him. With this, if a person is having mental anxiety or having anxiety neurosis syndromes and like problems and disorders, this controls, Sarvagandha Ghanpati controls the disorders and syndromes. With this, if anybody is have manic problem or manic patient sleeplessness, some manic patients are sleepless and their sleeps is disturbed, so this medicine is very helpful in this condition. So overall, this is a high blood pressure, insomnia, sleeplessness, restless sleep and mental anxiety and anxiety neurosis and maniacal disorders. So this medicine is very beneficial in these conditions. So this is an Ayurvedic medicine, and this should be taken very carefully by the patient, and especially for beneficial this medicine is for high blood pressure patient, because it controls the high blood pressure and should not be taken by to low blood pressure patient, because it lowers the blood pressure if the medicine is taken continuously. So note it that it is a beneficial medicine for high blood pressure patient. But if anybody likely to take it, then he can take a very low dose of this medicine. Should be taken 1/3 or half part of tablet once a day, so that will also be beneficial. And one thing is better that if this medicine will be taken under supervision of any qualified Ayurvedic practitioner, then it will be much better. So overall, this is a nutshell of an Ayurvedic beneficial remedy. So take it with care, and I will appeal you that every day we cast video
with different aspects on Ayurveda, homeopathy, Unani and nature cure and other therapies with genuine and true and updated information. So please share and subscribe my channel and tell about my channel to others. If you have any problem, then you can ask to me by telephoning me, and you can visit my website www.etgayurveda.com and YouTube channel, and leave your comments there. You can send me email on email address drdbbajpai@gmail.com. And lastly, if your any relative is sick or have those conditions which have no treatment, that is told by your physician, so please do not panic with the statement of your physician. And we are treating incurable disease conditions by Ayurveda, homeopathy and Unani remedies, and suggesting patient what to do and what to avoid and changes in his lifestyle. You can come for treatment to our research center, but before coming here, please have a talk to Dr. A.B. Bajpai, and you can directly come at our research center personally. If your any relative or concern is suffering from those disorders which have been declared incurable disease, kindly tell them about our research center. That will be much better. And thanks you for listening. Our motto is No Ayurveda for best life. And thank you again. Thank you.
Hello, I am speaking Dr. Deshbandhu Bajpai from Kanak Polytherapy Clinic and Research Center, Kanpur, India. Mobile number 86046291190. Today I will tell you about the ankylosing spondylitis, which is a very difficult condition to cure, and the disease is related to whole of the spine. Now you will see how this disease takes place. Ankylosing spondylitis is a disease condition of spinal column. With this, it is related with other visceral problems which occurs after the invasion of the disorder. Now you see here in this model the whole of the spinal column from here to here. You will find that this is cervical region, this is thoracic region, this is lumbar region, this is coccygeal region, this is sacral region. So these are the 5 regions in the spinal column, and ankylosing spondylitis is a combined problem of the cervical spondylitis, the lumbar spondylitis, the thoracic inflammatory condition and the other one. So the viscera are affected with the spinal column problems. The syndromes appeared that inhibits the movement of the body, and motion cause extreme pain. Other parts of the body are also affected due to impact of spinal column anomalies. The whole spinal cord becomes inflamed, and the visceral regions, the muscular region. Now you see here, this is the spinal column and the muscles are related with this spinal column. So this is a complicated disease condition. You see here the vertebral joints, how the vertebral joints are adjoined each other. This one is the spinal column. You see the 5 section of spinal column. When this all is in becomes in inflammatory condition, then it causes pain and the nervous system is affected. The related parts of body. Now this is now you see here, this is the whole spinal column, and this spinal column is controlled by this is thoracic vertebra, this controls here. So every part of body is controlled by spinal column. Both parasympathetic and sympathetic nerves are passes from spinal column, and therefore the cavities, this is the thoracic. Now you see all the cavities of the body. This is cranial cavity, this is the abdominal cavity, this is pelvic cavity, this is spinal cavity. So there is cavities which are affected the whole body system. Now this is the muscles and skeletal system of the back. So this also affects. And now you see, you have already seen these are the parts of the body. This is spinal column. Now all other adjoining are related with this spinal column. Now you see the spinal column and thoracic region, the lumbar region, coccygeal, and the internal part, which is governed and covered by this spinal column. That denies the function of the organs, the internal organs, and that's why the problem complicates. So now you have understand that the ankylosing spondylitis is an inflammatory condition of spinal cord, whole of spinal cord, not in a part. Sometimes in some part it could be create a major problem. In some other parts it could be a little one, but this is a problem of spinal cord. So ankylosing spondylitis is a curable condition by Ayurveda, homeopathy, Unani and others combined and integrated treatment. In our outdoor clinic at Kanak Polytherapy Clinic and Research Center, 67/70 Bhusa Toli Road, Kanpur. Mobile number 8604629190. All kinds of diseases and physical and mental ailments and disorders are treated by Ayurveda latest invented technology, electrophysiography, globally known as ETG, Ayurveda scan and Ayurveda blood and Ayurveda urine test basis reports and concluding results. Our specialty is very unique in the sense that we are treating those diseases and disease conditions which are declared by consultant physician that they have no treatment or there is no treatment of the condition. We treat the patient by Ayurveda and homeopathy and Unani remedies and suggesting to patient what to do and what to avoid and changes in lifestyle. Ankylosing spondylitis is not an incurable disease condition. The treatment is possible, and if your physician says that there is no treatment of this condition, please do not panic with the statement of your physician. You can come for treatment to our research center, but before coming here, please have a talk to Dr. A.B. Bajpai on mobile number 8604629190. You can contact and visit at our research center personally. You can log on to our website ayurveda.com to get more information about our works. If your any relative or concern is suffering from those disorders which have been declared incurable disease condition, kindly tell them about our research center. Thank you. I am speaking Dr. Deshbandhu Bajpai from Kanak Polytherapy Clinic and Research Center, Kanpur, Uttar Pradesh, India, and my mobile number is 86046299190. I will tell you in this video cast about the muscular dystrophy and muscular derangement conditions and their treatment. Thank you. Muscles are a prominent part of our body, and in muscular dystrophy and in muscular disease, the dystrophy is happening mostly here in the calf muscles. This is calf muscles. This is calf muscles. This one is calf muscles. These are gluteal muscles, and here in this muscles and in this muscles, particular here and particularly here. In this muscles, the dystrophy is happening mostly here and in this part and in this part, here and here. So what happened when dystrophy happening here? This is a normal level of muscles. You see here, you can see here, this is a normal level of muscles, and in dystrophy the muscles are dystrophied, increased in their size like that, increase in their sizes, and thus becomes a very rough surface of arms, and now here this area you can see, if it will happen, it will like that, it will happen, and this area will be much more prominent, this will area prominent, and the area here will also like that, seen like that, it will also seen like that. So dystrophy is the increment of muscle size and shape. So this happens mostly in this area, and the disease is known as dystrophy. So now you can understand better here. The size of muscles increases here, this size and this size. This makes a D-shape. And so also happen in the arm. It will like that, it will be. So The area will be called when the muscles will increase in their size. This is happening due to collection of fat, collection of any fluid, collection of any noxious subjects and others.
Of our body, with more than 300 individual muscles. They enable us to perform many complex body movements. They are responsible for all of our voluntary movements, and they are also involved in reflexes. A skeletal muscle is a bundle of long single fibers. The muscle fiber is the actual cell of the muscle, each containing at least one nucleus. Each muscle fiber, in turn, is itself composed of bundles of actin and myosin filaments, the so-called myofibrils. Their regular arrangement creates a striped or striated appearance of our voluntary muscles.
Collection of fat and protein or deposition of fluid or muscular tissue, incorrect functions or appearance of any kind of pathophysiology. There are few main reasons of having this muscular dystrophy complaints. Apart from it, there is also other many reasons which are causing this condition. In this way, muscles become hard and their shape becomes broader in size and thus inhibits their working natural capacity like relaxation, contractions and flexations functioning. So this is the reason. Collection of fat and protein or deposition of fluid or muscular tissue, incorrect functions or appearance of any kind of pathophysiology of muscles. These are few reasons for muscular atrophy, for muscular dystrophy condition and muscular diseases. Apart from it, there is also many other reasons which are causing this condition. In this way, muscles becomes hard and their shape becomes broader in size and then inhibits working natural capacity like relaxation, contraction and flexations, etc. The flexation is also inhibits due to these anomalies and abnormal muscles functions. We treat this condition by Ayurveda and homeopathy and Unani remedies and suggesting to patient what to do and what to avoid and changes in lifestyle. Muscular dystrophy is not an incurable disease condition. The treatment is possible. You can come for treatment to our research center, but before coming here, please have a talk to Dr. A.B. Bajpai on mobile number 86046-29190. You can contact and visit at our research center directly. You can log on to our website ayurveda.com, etgayurveda.com. If your any relative is suffering with any incurable disease condition, kindly tell them about our research center. Thank you.
Hello, I am speaking Dr. Drdbbajpai from Kanak Therapy Clinic and Research Center, 67/70 Bhusa Toli Road, Barkan Bazar, Kanpur, Uttar Pradesh, India. My mobile number is 8604629190. Today I will tell you about homeopathic remedy hydrastis. Hydrastis is a well-known phyto-based medicine which is used in primarily in cancer and cancerous state before ulceration, and at the time of when pain is a principal symptom. So this medicine is covered by these problems, and this is also used in thyroid problems and goiter of any stage. Hydrastis can be used. Smallpox, in case of smallpox and measles, this medicine can be used internally and locally both. The main seat of action of this remedy is based on the cerebral effects, prominently weak muscular power, poor digestion and obstinate constipation. Those who are having lumbago or back pain, weak and prostration feeling, they can use this remedy. This is also acts on the liver and the liver syndromes, and can be used very safely on fatty liver and enlarged liver in both conditions. Or any condition of liver, it is safe. Either it is a cancerous liver or other one, this medicine will help to improve the health condition. The main seat of action of this remedy is on the throat, stomach, uterus and urethra. Those who are old and easily tired people, cachectic individuals, and are feeling a great debility and cannot move, or motion is very difficult to those persons, hydrastis can help him. So these are the hydrastis features, and this is a very important homeopathic remedy which can be used in these conditions which I have already told you. But better if you take this medicine under a qualified homeopathic doctor near to you, that will be much better. So in the above condition which I have mentioned, you can use it, this medicine, with safety, and the dosage is very small. For children it should be given in 2 to 3 drops with 1 teaspoonful, and for adult 10 to 15 or 20 drops with a small quantity of water 2 or 3 times a day, and that is the safe one. So if your any relative or any friend or any person is suffering with the chronic disease conditions or any conditions for which he is taking a long-term treatment without any improving health condition, so you can convey to them about our research center, where we are using ETG, Ayurveda scan and Ayurveda blood and Ayurveda urine examination, and find out the genesis of the disorder which patient is suffering, and on that basis we are using Ayurvedic, homeopathic and Unani remedies to cover up all the symptoms and syndromes. So this is the best way for their treatment, because in other system of medicine, the chronic diseases are not well conducted or well appreciated. So this is the only way to use the ayush treatment and ayurveda treatment, both that will help them. Please like my this channel and share it to others. Tell them about our activities and go to our website etgayurvedastand.com and see there our activities. Write your opinion about what we are doing and suggest how we can improve our this video linking. So thank you very much. Thank you for your visit and listening. Thank you.
Hello, I am speaking Dr. Deshbandhu Bajpai from Kannada Polytherapy Clinic and Research Center, Kanpur, Uttar Pradesh. Mobile number 8604629190. In this video, I will tell you about the leukoderma, vitiligo, white spots and related problems which are related to skin and skin disorder. Now you see this is an skin area and like that you can see here this is a skin area and white patches that appears in the could be in any part of the body from head to tail, head to foot. It could be from foot to head, and white patches can appear in a bunch or in any small spot, small circular spot anywhere in the body. So let us first understand the structure of skin. This is a model in which you will see the skin structure. This one is a layer of fat. This is a layer of fat. This is a layer of melanin. This is another layer of melanin. This is the skin surface. This one is the last surface. So you can see here in this picture how the different parts of skin is shown, and the lack of melanocytes. Now in this picture you will see here the melanocytes, how the melanocytes appear here, and in this also you can see how the lack of melanin creates the disorder. Now this is the layer of melanin. You see here the supply that goes to here, the deficiency that begins here, and the white spots that appears here. This is a natural. The normal supply of melanin is from here, that goes to here, and then at last it collects here. So the lack of melanin is the main cause of disorder. Leukoderma or white spots or vitiligo are the disorders of skin and skin related pathophysiology and pathology. In this disorder, White patches are seen on the skin which could be in any area or part of body. The reason of this disorder has been established in medical books in a shallow way. Ayurveda says that this condition is due to wrong dieting habits which are not matches and suits and have anti-properties. So, in our outdoor hospital, we have treated a large number of leukoderma patients, and we have seen that every patient has individual cause for the appearance of disorder. The genesis of leukoderma differs from individual to individual patient. Chemical chemistry, electrolytes, pollution, minerals deficiencies, and other factors like food habits, lifestyle, and mental behavior, it increases the level of disorder. By virtue of latest Ayurveda diagnosis system, ATG Ayurveda scan, it is now possible to find out the genesis of any disease problem inside the body. The Ayurveda blood examination and Ayurveda urine examination provides opportunity to analyze and synthesize blood chemistry anomalies inside the body. Concluding the problem and diagnosis, appropriate and suitable Ayurveda and homeopathy and Unani remedies along with the suggestions of changing food habits and lifestyle assures to meet the cure to the sick person's condition. Majority of cases responses well by Ayurveda and ayush integrated and combined treatment, and sometimes 100%. The another reason is the malfunctioning of the large intestine, the small intestine, the liver, and the pancreas and the spleen. Sometimes kidney also creates a problem of these are the kidneys, and sometimes some kidney problems creates white spots problem. So by virtue of ETG Ayurveda scan system, everything and every part of the body is examined, and after examination a prescription of Ayurvedic, homeopathic, Unani and other medications are suggested accordingly to cure. We have 100% track record of treating leukoderma patient at our hospital, and if anybody is interested to take the treatment, he should consult to Dr. A.B. Bajpai on mobile number 86046291190, or you can contact and visit at our research center personally. You can log on to our website etgayurveda.com to get more information about our work. If you or any relative or concern is suffering from those disorders which have been declared incurable disease condition, kindly tell them about our research center. Kindly see our videos at our Dr. D.B. Bajpai channel, and thanks for listening. Thank you.
Hello, everybody. I am speaking Dr. H. Bandhu Vajpai from Kanak Polytherapy Clinic and Research Center, Kanpur, and my mobile number is 86046291190. Today I will tell you about the disease condition and its treatment and management, and what to do if anybody is suffering from uterus cyst and tumor disorders of females. In this broadcast, the subject of discussion is uterus cyst and tumor disorders of females. This condition is particularly related to the females and their reproductive parts respectively, and the suffering symptoms are very individual to individual patient. Before going to enter the subject, let us understand with the help of model and picture the condition and shape and other related information about uterus and its adjoining parts. I would like to share you and try to tell you about the uterus with the help of model and pictures. So now you see here, this is a picture where you can see the uterus is here. This is the uterus, and now ovaries. Now ovaries are shown here, but this is uterus actually, and you can see it here. The ovaries are shown here, but this is uterus. So the condition of uterus you can see here in this picture, and the it is connected with the connective tissues, and now this is normal uterus you can see, and this uterus is actually consist of now you see here this one. Now this part is actually uterus, this one, and inside this is endometrium, this part. Now you see here endometrium, myometrium, and cervical canal. So these are the parts you can see, and now in this model I will show you. In this model you will see the uterus in total, and it's a four-dimensional. You can see how it is. Now this is the actual position in abdomen of uterus. So you can see here the overall all the four dimensions you can see. So this is the external part of female genital organ, and this one is the vaginal part, and this one is the uterus. From here the uterus starts here, and now this is cervix. As I have told you already that this is cervix. So now you can see here the cervix, and the other part you can see here. This is ovary. These are the fallopian tubes. The fallopian tubes are here, and this is ovary. So now this one is the external part of uterus. Now it is shown here. You can see the shape. Actually, the model is a kind of a original description and this original model of the organ. So the model is shown here is basically the original one, and Now it's a little one, but you can see the internal part. You can see the endometrium and myometrium, and this is the part one. The external part is here. Now this one is the external part. So what happened? The tumors are generally produced here. This is the area. The external area of this one around the overall. So this may happen to any place from here to here, and here to here, and here to here, around all around. So it can happen. The tumor can be happen at any place. So you see here, these are the external part, and this one you can see. You see it carefully. So now it is also the controlled by the now you see here the autonomic nervous system. So autonomic nervous system controls the body function, and here you can see in last the ovary, the connection of autonomic nervous system that goes from here to here, and lastly to uterus. So you can see here the autonomic nervous system plays a very vital role in the decision of ovaries, and you have seen the model, and the connectivity of autonomic nervous system of uterus. So the uterus generally it is persist here. This is the place where uterus persists. So now you have got the idea of the uterus and the location of uterus cyst and uterus tumor. So now again it is observed that the problem of uterus cyst generally seen in majority in age group of over 20 years to 45 years of females. Either they are married or unmarried. I have treated many unmarried females with this problem duly diagnosed by the ultrasound findings. During the Ayurveda and ayush treatment, the condition is monitored time to time by ultrasound and blood examination to see the effects and progress of the treatment, and management is given to an individual patient. Earlier, it was the concept that married women could be a victim of disorder due to problems after delivery or abortion, or D and C procedure, or malaria and virus fever, or infection of tuberculosis, or external penetration of anything hurts the uterus, etc. There could be more causes which are yet to confirm after proper examination and diagnosis. Signs and syndromes can be seen after examining abdomen and parts affected. Lower abdomen is painful and sometimes Slight external pressure causes the acute pain with this feeling of feverishness, restlessness, and vomiting feeling. Examination shows the mucous surface is thick and inflamed and swollen. Uterus becomes very sensitive on touch, and even least motion and pressure and jerks and shocks are very painful. Endometritis, myometritis, and pyometritis are commonly seen in the base of trouble that causes cyst and tumor formation. With this, the lymphatic glands carries the metastasis, and thus lymphatic system is involved in increasing the size of the cyst and tumor. Muscular tissues and cellular pathophysiology is the cause of disease, which allow to deposit the lymph fluids in the cell and the tissues. Treatment with Ayurveda and ayush therapies are recommended to cure the condition, with time to time monitoring its sizes and ultrasound examination. At our research center, we have treated patients satisfactorily and safely by integrated approach using Ayurveda and homeopathy and Unani and yoga and nature cure management and treatment simultaneously. So, this is overall about the uterus cyst, and I think that I have given proper information about this condition. And at our research center, we have treated with the 100% success in epilepsy cases, in hysteria, in leukoderma, in psoriasis, and in avascular necrosis, chronic and acute pancreatitis, HIV, muscular atrophy, muscular dystrophy, fistula, Bagandar, cold, hemorrhoids, anorectal disorders, fatty liver and enlarged liver, ankylosing spondylitis, cervical and lumbar spondylitis, sinusitis, and including ENT are generally cured by the integrated treatment. 100% nephritis, gurde, stone of kidney, diabetes, enlarged prostate, body swelling, anus ascites, colitis, uterine cyst, and uterus problems, and male reproductive organs problem. Generally, we use ETG Ayurveda scan, the 3 ways of examination, and including the ETG Ayurveda scan 3 label examination with Ayurveda blood examination and Ayurveda urine examination. We go for the genesis of the problem of patient and find out from where the present syndromes are coming, and then we support with the Ayurveda, homeopathy, Unani, and allopathy remedies in integrated way. So, if you are any relative or friend or in your touch or whom you know is suffering from any chronic disease and incurable disease condition and is feeling himself in trouble with the current treatment without any relief, kindly do tell them about our research center. And I will like to request you for subscribe and share and like my channel. Tell about this channel to others, your friends and relatives, and especially to Ayurveda lovers and Ayurveda followers, Ayurveda students and Ayush therapy students and teachers and lovers should listen it. This channel is actually dedicated to promotion and propagation for the development and arouse consciousness and awareness among the global public about understanding of Ayurveda and homeopathy and Unani and yoga and nature core systems for good health approach with practical way. Visit our website etgayurveda.com for more information and our activities. Visit our YouTube channel for updated video related to different aspects of Ayurveda and homeopathy and Unani and other system of treatment with updated information which are genuine and true and of practical use. The contents are given in this video and telecast are only for the general information. It will be much better to follow the suggestions with the help of concerned medical systems, qualified practitioner or physician of Ayurveda or homeopathy or Unani and other therapies are concerned. Thanks for watching. We'll see you tomorrow at the same time. Thank you. Thank you. Namaskar.
Hello, I am speaking Dr. Deshbandhu Bajpai from Kanak Polytherapy Clinic and Research Center, Bhusa Toli Road, Bartan Bazar, Kanpur, Uttar Pradesh, India. My mobile number is 86046291190. In this video cast, I will tell you about the HIV infection and its treatment, its Ayurvedic cure, homeopathic cure, Unani cure, and combined and integrated treatment of HIV, high immune deficiency disorder or human autoimmune deficiency disorder treatment as well. Thank you. You see here one band